29th of September 2021. It's such a special day in every single person's life, and in a few minutes I will be telling you why, because we're about to discuss something which is integral to life, an organ that every human being has, and without which you cannot even live past a second or maybe a minute. The health expert is here. He would correct me if I am wrong, but today's a very special day, I mentioned, because it's World Cardiovascular Day or World Heart Day. Who doesn't have a heart, and who doesn't want to protect the heart that they have? Now, there are some very scary statistics out there. In 2019 alone, 17.9 million people worldwide died out of cardiovascular diseases, and out of this figure, 85% of them were strokes and heart attacks. Very scary. And according to the American Heart Association, somewhere in the world, not everywhere in the world, somebody somewhere in the world, every 39 seconds passes on to the other side or dies out of cardiovascular diseases. So that means that today is a very special day. If you are just tuning in, please make sure that you call a friend, call a family member, send messages around, let everybody listen to this conversation, because once your heart stops, your life has also stopped. So let's just get into the nitty-gritties of today, Heart Today. My guest in the studio this morning, Dr. Eugene Befi Ampofo. He is a physician specialist at the National Cardiothoracic Center, Kolebu Teaching Hospital. Good morning, Eugene. Can I call you Eugene?
Yeah, you can.
It's fine, right?
It's fine. Yeah.
Good morning.
Good morning.
Very scary statistics, if you asked me. When I was reading around was when I chanced upon this information that in the world, in every 39 seconds, somebody somewhere in the world dies out of CVDs, cardiovascular diseases. It's very scary. What's the situation like in here in Ghana? But before we even get to Ghana, today is World Heart Day. So how are we commemorating the day here in Ghana? What's happening in Kolebu especially?
All right, thank you. So first of all, I want to thank the leadership of the National Cardiothoracic Center for giving me the opportunity to talk today here on the World Heart Day.
Right.
Special thanks go to Dr. Samet Tanko, who asked me to represent him here.
Okay.
So today, at the center, there's going to be a virtual debate, or where we're going to discuss the World Heart Day. So there's actually going to be a virtual debate, which I had sent a link earlier on to Oliver. As many people can join the debate, because we all know what is happening in the country. COVID has made organization of such programs a bit difficult. And ideally, we would have done the usual health walk, health screening, and move from companies to companies to interact with them. But COVID has made it a bit challenging to do that. So today is going to be a virtual program, which is going to educate the public.
All right. So the link you've sent it to the producers. Yeah. Okay. So I'm sure they'll be putting the link down on the screens so that you can also join. What time is it starting?
9 a.m.
So it means. What time is it? Oh, it's 9:25. It started some 25 minutes ago, but of course, once we have access to the link, we'll be able to join.
Yes, it's
fantastic.
A Zoom link, yeah.
Okay, so now let's get into the conversation proper. When we say cardiovascular disease, or when we say you have an unhealthy cardiovascular system, exactly what are we talking about?
All right, thank you for the question. So when we say cardiovascular disease, from the name, cardio, representing the heart, vascular, representing the pipes that carry blood away and to the heart, what we call arteries and veins, okay? And so diseases that affect literally the heart and these pipes, these arteries, okay? And broadly...
So the heart and its arteries.
Yes, and the vessels.
Okay, vessels.
Yes,
yeah,
vessels.
Yes, because I was trying to say that for the layman who doesn't understand arteries, can we just say, are we correct if we say vessels?
Yes, that's why I said pipes, trying to make it simple as much as possible, carrying blood away. So consider the heart as maybe Ghana water, the central station, and the pipes being the arteries carrying water, connecting
to the various homes.
So the pipes connect the heart to the various parts of the body, so that it will send blood to the various parts of the body, in simple sense. So these are a group of diseases that tend to affect this particular system, and On top, we have, when we take we have on top the disease which we classify as, let's say, what we call coronary artery disease. Basically, when we say coronary artery is, like we said, is a vessel. Yeah. Okay, so coronary represents like the heart. Okay. So the pipe that sends blood to the heart. So diseases that affect the pipes that send blood to the heart are generally called coronary artery disease. Okay. And they can manifest as what we usually know as heart attack. Right. Okay, and also it involves diseases such as strokes. For example, the diseases that affect the pipes of the heart can also affect the pipes of the brain, the vessels. And if the vessels of the brain get involved, then we say the person will develop what? A stroke. Okay. Wow.
You're about to give me some revelation this morning, because I've got family members who've actually passed on to the other side as a result of strokes. Now, I'll give you a clear example. When my auntie was sick, she was sick for just 7 days. So she was in the bathroom and then she started shouting that she has a headache.
Yes.
We rushed her to the hospital, and then by Wednesday, she started to act funny. Yeah. You could tell that her brains were not working properly. She was saying funny things. You could just tell that she wasn't herself. And then next thing we knew, her tongue was out. Yeah. Next thing we were told that she's developed a stroke. I said, in 7 days, how is that possible? So how does the brain affect the heart, results in stroke? Can you break it down for the layman to understand? Because I've been very confused from that point in time till now. Explain it to us.
Okay, so the underlying process that leads to cardiovascular diseases in general, i.e. affecting the heart vessels, the brain, can affect the arteries of the legs, basically is what we call atherosclerosis. It's a big word, but I'll break it down. Okay. So basically what is happening is that you tend to have a process that leads to blocking of the pipes, that's the vessels that supply blood to these vital organs. Okay. And there are risk factors that predispose or hasten that process. And one of the risk factors is hypertension. Okay, we have diabetes, we have smoking, we have obesity, we have physical inactivity. These are what we usually will call as the traditional risk factors. They are traditional because they have been known over the years to have been associated with this cardiovascular disease. But they are new risk factors, which
there are newer
ones, if time will allow, we can talk about it.
Let us into it.
So there are newer ones such as air pollution now is being associated with cardiovascular disease. And mental health, which has not been considered over the past years, also increases your risk of cardiovascular disease.
Are you kidding?
Yes. And also
mental health.
Yes, mental health increases your risk of cardiovascular disease. And also conditions that we are not used to. For example, someone with what we call rheumatoid arthritis. These are conditions that have been shown as newer risk factors for cardiovascular disease. People with respiratory diseases, lung diseases, are at higher risk. So back to your auntie, if I remember rightly. So it may be that she might have been hypertensive.
She was hypertensive.
Yes, and which is one of the major risk factors in this country.
Yes,
in Ghana currently, the leading cause of death is hypertension, hypertensive heart disease, and stroke. So so she might have been hypertensive and probably not well controlled.
Okay.
One of the top risk factors is hypertension.
One thing I know, and I'm sure I'm speaking for a lot of people out there who are also going through it or have relatives who are going through it. One thing I know was she was on medication, but in her last days before she passed on, before we even got to the hospital, she was stressing over so many things. A lot of things were stressing her out. Yeah. Is it a contributory factor?
Yes, like I mentioned earlier, psychosocial and even mental health are one of the risk factors that we've not been talking about, but because they are not considered the traditional risk factors. So that could have contributed to probably her blood pressure is going out of control.
Yes, it did go out of control.
Yes. So when it goes out of control, the brain adjusts to your blood pressure. And if the rise in the blood pressure probably was too high over a short period, the brain will not have had time to adapt to that sharp rise. And that can lead to a cascade of things. One of them being possibly a bleed. Let's say if you have a pipe, okay, with a particular thickness, which is the vessel, and suddenly the blood pressure in the pipe rises. This kind of water decides to pump water at an unusual pressure that it does. If your pipe is unable to handle that pressure, it will burst.
Doc, so that explains it then, because in her last days, actually the last day that she passed, we were asked to do a CT scan of her head. By the time the results came, the veins in her head were torn.
So that is one type of stroke.
So it means that what you're saying is very true. If the pressure is too much in the head, it can actually get the veins to get torn. And blood flow will not get into the other parts of the body. Yes.
So let's say a part of the brain that gets blood supply, that vessel, that pipe gets burst.
Right.
You understand? It means that that part of the brain is not going to get adequate blood supply.
True.
And without adequate blood supply, that area of the brain is going to die. And when that place dies, depending on the function of that part of the brain that is dead, you will lose that function. So if that part of the brain involved controls speech, then you lose your speech.
That's why her tongue was out, because she couldn't talk anymore.
That's it. So depending on the area of the brain in which the area of the brain involved, then you have the manifestation of the stroke. So not every stroke leads to loss of speech or weakness. It depends on which area of brain tissue you've lost the function.
Okay, so since we're talking about strokes, let's just do this before we even get into the other things I want to talk about this morning. If you have a neighbor or you have a family member who is suffering a stroke, what will be the signs for you to see? What are the signs and symptoms for you to see that, no, there's something wrong?
Yes, so the patient, the neighbor may start having difficulty talking.
And does it just happen, or it happens over time?
So by definition, stroke itself is a sudden event.
Just like that,
yes.
One time.
Conditions that tend to affect the arteries, or what we call vascular, are usually sudden.
Just sudden.
So when you come and you complain, the presentation, the sudden nature, increases the likelihood that you are dealing with a stroke. So it's usually a sudden event.
Wow.
Usually a sudden event. Either there's a block in the blood supply to the area of the brain, or the pipe itself has burst. And usually, even though the process leading to it might have started years ago, but what leading to the stroke itself is usually sudden.
Now, when I was reading around, I found out that, so since you're saying it's sudden, so just a sudden drop in the face is a sign?
Yes, so you may have what we call asymmetry in the face.
Okay.
So a part of the face
one side of the face just drops.
Yes, because the face, as you see it, is supplied by nerves, and the nerves arise from where? The parts of the brain. So if the area where the stroke has occurred controls that part of the face, then you may lose that function of the face. So it could either be the left side or the right side.
And is it true what they say that when you have a stroke developing on the right side, it's safer than the left because the left is where your heart is? Is that correct?
That's not correct.
That's not correct. So either ways, it's still very dangerous.
Yes.
Oh, wow.
What determines which side of stroke, which side of weakness, is dependent on which part of the brain the stroke occurs. The brain is such that the left brain, in simple terms, controls the right. So if you have a stroke on the left, the weakness is going to be on the right. And if you have a stroke on the right part of the brain, the weakness is going to be on the left, so because of how the nerves are arranged in simple sense.
And is it also true that sometimes one side you probably cannot lift your hand, you cannot move if it's a stroke?
Yes, because like I said, the brain has several functions. And one of the functions of the brain is motor function, movements. So if the part of the brain affected is a part that controls motor function, then that area you will lose the motor function, either completely or it will be reduced. And the body is represented on the brain. The head to your toe is represented on the brain, what we call the homunculus. So depending on the area affected, it will manifest in that area of the body.
Okay. So thanks for expatiating on this stroke detail of our discussion today, but there are a few things that I want to come to. We have covered stroke. There are a few differences I want us to be able to educate ourselves and the public on this morning. Oftentimes you hear people say makuma yemeya. Is that a tightness in the chest, or it's actually a pain in the heart? And if it's a pain in the heart, what's the difference between the pain in the heart and a tightness in the chest?
Okay, thank you. So when it comes to language, medicine was not developed in the Ghanaian languages. So communication can be challenging. So I will not say in the Ghanaian language, if a patient comes and says he's nakuma yemeya, you have to be able to break it down, and based on the patient's risk factors, try and ask yourself, what is the likelihood this pain is coming from the heart? Because the fact that the patient is complaining of chest pain does not necessarily mean it's coming from the heart.
So there's a difference between heart pain and chest pain?
Yes, they are different. And there are descriptions of the pain that makes us suspect it's likely.
So how do you know if it's heart pain as a physician specialist?
So for example, cardiac pain is usually what? Inducible. It's exertional. So a patient comes to me who is hypertensive and diabetic or smokes, already has significant risk factors, comes complaining that I get chest pain when I walk 100 meters. And when I stand, the pain goes away. Or I get chest pain when I'm climbing the staircase, and the pain goes when I rest. This is a typical description of cardiac pain. Why? You get the pain because on exertion, there's increased demand by the heart. The heart requires more blood when you do more. Now, if you have blocks in the arteries that supply the heart, and you are exerting yourself, and the heart is asking 100 mils of blood, but because you have blocks, you are giving the heart 20 mils of blood. What happens is that the heart muscle, the cells, have to get the energy. But there are two ways of producing the energy. The main system, which we call like the Krebs cycle, that gives enough energy. And a weaker system that produces less energy because there's less oxygen. So the heart will switch to the system where it has to use less energy because you are giving it less blood, less oxygen. And that leads to the buildup of some chemicals. One of them is lactic acid. And that's what irritates the nerves of the heart for you to have the chest pain. So indirectly, your body is trying to put you on halt so that you don't overstretch it, because if you overstretch it, now that part of the heart may completely cut off.
I see.
So that chest pain is good to tell you to rest.
Right.
So such a description is suggestive. Or patient comes in, I have sudden chest pain, I was sweating, I felt like vomiting, and the pain moved from this area of my chest to my left arm or my left jaw. These are things that suggest the pain coming from the heart.
Left arm or left jaw?
So left arm, left jaw. I was sweating, I felt like vomiting. These are descriptions that raises your alert.
You should see a physician.
Yes, raises your alert.
Oftentimes, or sometimes, let me put it that way, you just, out of nowhere, you just feel sharp pains in your chest. Is that cardiovascular as well? It happens a few times and that's it.
Like I said, not necessarily. See, we don't treat patients in isolation. The story you tell us, we weigh it in the context of your risk factors. For example, I can have a 70-year-old female come with heart attack, chest like a heart attack, and literally come complaining of belching. Okay, so
in actual sense, that's what I was coming to, for you to explain what heart attack means. Oh, yes, what happened on your heart attack? Exactly what does it even mean?
So a heart attack is the layman's term for what we call an acute coronary syndrome. Okay, so the one like what is showing on the screen, when you have a block, so when there is a gradual narrowing of the pipe, the arteries that supply blood to the heart, it's gradual. So such a patient will come with chest pain on exertion. He gets chest pain when he walks because the narrowing is gradual. So the heart has some time to compensate. So that is what we call angina. Now, when that obstruction occurs suddenly, so there's some narrowing, let's say 60%, and something happens and all of a sudden it goes up to, let's say, 90%. Something happens and a clot forms on it and it goes to 90% or even complete total block of 100%. The patient will come with sudden worsening of chest pain. And that sudden worsening of chest pain is what the layman will call a heart attack. But in our language, we'll call it acute coronary syndrome because there are three components to the presentation. So heart attack, in simple terms, you can say is acute coronary syndrome, but most people will say it's what myocardial infarction. So when we say heart attack, basically there's been a sudden cutoff of blood supply or worsening blood supply to the heart.
Now we are in a special dispensation, and I'll say special dispensation because we all didn't expect it. Corona. And we know, or we've been told, that it also comes with some CVD difficulties as well. How scary is it for somebody who's contracted corona? Is the person very close to developing cardiovascular diseases permanently?
Thank you. So the COVID and the cardiovascular system has two dynamics.
Okay.
One, I'll tackle one is where you're coming from, where the COVID itself, the COVID-19 virus, has a direct effect on the cardiovascular system. It's a virus, and when there's an injury to the body, what the body does is to respond to that injury. So any living tissue responds to injury, and the response to injury is what we call inflammation, the body's response to that injury. That injury could be a virus, could be a bacteria, could be trauma. Now, the virus itself can also affect the heart. It can invade the heart muscle, or the process of COVID itself, the body's response to COVID, which is the inflammation, the body trying to fight the virus by producing soldiers and chemicals to kill it. Those chemicals and soldiers can also attack the heart, apart from the virus itself also invading the heart. So the COVID itself can affect the heart directly and indirectly, leading to the inflammation of the heart, what we call myocarditis. And that can actually lead to the heart failure.
Wow.
Another dynamic to it is that people with cardiovascular disease and established and already high risk for severe
are
COVID.
Very prone to corona?
They are not necessarily prone, but because of COVID, they were afraid to come to the hospital. So there's a different twist to it. So these people who needed that routine care were not coming to the hospital because they were afraid. Because it was clear that they were high risk. So that is another dynamic.
So did we lose a lot more people in 2020,
So I don't have the data, but I can tell you we might have lost people who necessarily didn't have COVID,
corona,
but had probably heart failure. But because the presentation, because if you have a heart failure, you come with difficulty breathing. And at the time, most hospitals were not prepared on how to manage COVID. So if you come with difficulty breathing, it might have been heart failure or heart attack.
They'll just run you over to corona.
And you would have been denied care. And so
I can just imagine. I can just imagine. I wish we had a lot more time to get into. I have too many questions for you, but I'm sure at another good time you'll come for us to exhaust it. But quickly, we've been talking about the scary parts. Is there prevention?
Yes, there is.
Quickly, maybe give us 3.
So the theme is use heart to connect for the 21.
Use heart to connect.
Yeah, you are using the heart to connect. And the reason is that, like I said, because of COVID, we couldn't have direct access to people. So 2021, the goal is to leverage on technology, digital health, to try and bridge the gap in terms of creating awareness, prevention, and management. Yes, there's prevention. The traditional risk factors, know your values, know your risk. How will you know you're hypertensive if you don't go and check your blood pressure?
You will know.
How will you know you have diabetes if you don't check? Yes, smoking, you will know if you smoke, but so then you have to cut down the smoking. If you are on the higher side of weight, what are you doing? What's your physical activity? These are things that we can do to minimize the cardiovascular disease incidence, because if you don't know your risk, there's very little you can do.
Too little time, too many things to talk about, but definitely we'll have you back here. Dr. Eugene Befi Ampofo, he's a physician specialist at the National Cardiothoracic Center, Kolibu. And today is World Heart Day or World Cardiovascular Day. Please make sure that you take care of your heart. It is very important. Without a heart, you don't have a life. Thank you so much for joining us this morning. We'll definitely have you for an extensive discussion later on here